I'm going to talk to you about better but not well. My name is Diane McIntosh. I'm a psychiatrist in Vancouver, British Columbia. What are some of the unmet needs in the treatment of major depression? Well, we know that our treatments in psychiatry are not perfect, and the STAR*D data was really valuable in helping to elucidate that for most of us. We know that with the first treatments, only about 50% of patients experienced a response, and less than 40% remitted. And for every step afterwards, every subsequent step, patients had a lower likelihood of responding and certainly far lower in remitting from their symptoms for each treatment step that followed. We know that residual symptoms of depression are extremely important, and this JUD data, I think, is extremely valuable in helping us to understand the power of residual symptoms. The first line shows individuals who are completely asymptomatic. They have no symptoms at all, and they've had 1 to 3 previous episodes of depression. These individuals have a median time well of about 4.5 years. The next line shows individuals who have also been completely asymptomatic. They have no residual symptoms at all, but they've had more than 3 previous episodes of depression. And you can see there's a substantial difference in the slope of the line. People go from 4.5 years well to much less time before they have a next episode. That's probably related to the illness going from an acute episode of depression into a more chronic inflammatory illness that occurs on average around episode number 3. The next 2 lines show individuals who have had 1 or more residual symptoms of depression. These individuals go from 4.5 years well down to about 6 months well. Doesn't matter how severe the depression was or how many previous episodes, it shows the power of residual symptoms. Interestingly, Dr. Judge replicated that data a couple of years ago and found exactly the same kinds of outcomes, that individuals who have residual symptoms do less well in the long term, are more likely to have subsequent episodes of depression. We also know that it's not so much the symptoms of depression that continue or the relapse of depression that's at greater risk, but also that people have more abnormal functioning, that they struggle to get on with their lives when they have residual symptoms, when they haven't fully remitted from depression.